Hi, my name is Sean Casey. I am a Paediatric SpR and I'm also the HST lead for health and wellbeing at RCPI. We're obviously living in very difficult times as far as our personal and our professional lives are concerned. And I would like to congratulate everyone on the incredible work you've done and the incredible work you're continuing to do to fight this pandemic. As frontline healthcare workers, our health and wellbeing has really never been more important in order to allow us to work at our best. But simultaneously, our health and well-being is never more in jeopardy. I'd like to share with you some of my thoughts on how we can get through this together. There are a number of things that are outside of our control. This virus has spread very fast and has spread very far, and we know it will continue to spread over the coming weeks to months. It carries with it a wave of fear and uncertainty that I believe is in many ways as powerful as the virus itself. I would like to emphasize the things that we can control. There are a number of seemingly small behaviors and actions which, taken collectively, can add up to a really powerful support tool for ourselves and for our colleagues. The first point I'd like to make is about personal safety. We have a key role in fighting this virus, but that potential for beneficial effect is reversed if we ourselves become infected or if we happen to infect our colleagues. I know nobody likes PPE. It's not easy to put on or remove. It's uncomfortable and it will make you sweat in places you didn't even know existed. But it is essential. I know it's particularly difficult and requires a particularly high amount of self-restraint when it comes to slowing down the care of a patient with COVID disease to put on your PPE properly. But I think we can help each other out with this. So it could involve having a buddy system where you spot check one another as you're putting on or taking off your PPE. In particular, we can look out for our colleagues who are new to our clinical areas, colleagues who perhaps returned to work or have been moved from other clinical areas to fight the pandemic. And we can all do our best to make sure these colleagues feel adequately trained and adequately supported to work in our clinical areas and to work in them safely. And this brings you on to my next point, which is about education and educating ourselves about this pandemic as it unfolds. We live in a hyper-connected age with a huge potential for misinformation. And so before sharing any articles or documents, we need to check the source reliability and question the strength of the evidence being presented. The main resources that I'm relying on are updates from my local hospital group, are updates from the HSC website, and updates from the RCPI. For example, at RCPI, we are launching a series of content which has webinars from top-level clinicians providing clinical updates, and also a variety of health and well-being policies and documents which can hopefully act as a powerful support tool for people. I'd ask everyone to engage with these resources, particularly the health and well-being resources, and to feed back to us through the health and well-being department so we can figure out how best we can help you. With that, there are times it's important to disconnect as much as possible from this pandemic and just try and live our lives as normally as we can. It could involve turning off a phone or turning off social media at a certain time in the evening. It could involve exercise or mindfulness, whatever works for you. I'd ask everyone to consider the routines we had before the quarantine and to try and apply them as much as possible to our new lives. It's important, whatever we do, to try and carve out some point in the day where we have a safe space and just allow ourselves the time to heal from the stresses of that day. We're still relatively early in the course of this pandemic, and there's a real need to conserve our energies for what lies ahead. So ultimately, this virus has changed our personal and our professional lives in ways that many of us never even imagined possible. But if we consider that we're in it together, that through solidarity in supporting and listening to one another, and through collegiality in educating and elevating one another, then we can have hope. And at times like this, hope is a really powerful thing. So I thank you for taking the time to listen to me. I would ask everyone to look out for one another, and please don't forget that your college at RCPI is here to help you in whatever way we can. Thank you.